Stretching and exercises have been shown to greatly reduce the pain and pathology associated with plantar fasciitis. In fact, a study by Wolgan in his article on conservative treatment of plantar fascial heel pain showed that exercise and stretching alone proved to be the best treatment for reducing plantar fasciitis symptoms in 29% of patients. Student Dr. Jacoby will now demonstrate for us some of these simple exercises and stretching techniques.
The first stretch we will go over is the calf stretch. Find a wall in your house. Put one foot up against the wall. While keeping the leg straight, lean in towards the wall.
This will stretch the gastrocnemius and soleus muscles and their common tendon, the Achilles tendon, which inserts in the back of the calcaneus or heel bone.
You will hold this stretch for 20 seconds, then rest for 10 seconds. You will complete this cycle 3 rounds on each foot. The next exercise is very similar. You will put your foot in the same position, however this time bend your knee, taking the gastrocnemius out of the stretch, focusing on the soleus.
Tightness of these muscles reduces dorsiflexion range of motion, which is a risk factor for plantar fasciitis. Thus, stretching the muscles alleviates the pain associated with the condition.
An alternative way for this stretch is to take a towel or a TheraBand and sit on the floor. You will take the band and put it around the top, the sole and the top of your foot, pulling towards you. Hold for 20 seconds, rest for 10, completing 3 rounds on each foot. The next exercise will be a stretch of the intrinsic and plantar fascia. You can sit down for this one. Make a figure 4 with your leg and take your shoe off. Have one hand stabilize the heel, while the other hand grab the toes and pull them towards the top of your foot.
By stretching the intrinsic muscles of the sole of the foot, you help separate the muscles that have become compressed from plantar fasciitis and are contributing to the discomfort that is felt.
You will hold that stretch for 10 seconds, then resting for 10 seconds, doing that 10 times on each foot. We will continue to stretch the plantar fascia. You will need a frozen water bottle. What we will be doing here is rolling your foot over the frozen water bottle. Socks are optional. You will do this for 2 minutes.
Using a frozen water bottle helps to not only stretch the fascia, but it also reduces the swelling because of the cold compression. Now that the stretches are completed, it is time to work on exercises that strengthen the intrinsic foot muscles. Student Dr. Jacoby will now demonstrate these for us.
You will need a small towel. Lay the towel on the floor. Sit back down and place your foot on the towel. You will then curl your toes until the towel comes closer to you. When the towel has reached all the way to your toes, what you need to do is stretch the towel back out and repeat. You'll do 2 cycles on each foot. The next exercise, you will need small objects such as marbles, or if you don't have marbles, you can simply take a piece of paper and tear them up into 10 to 15 small balls. You can put them in a bowl and dump them out. Put the bowl to the side. Take your foot and grab the small balls with your toes, placing them into the bowl. Once all the balls have been placed into the bowl, you will re-dump them out and start again. You will do this 2 times for each foot. The last strengthening exercise is called the toe tap. What you will do is you will stand on one leg. If you have trouble balancing, make sure to grab onto something such as the wall. You will point your toe to the front and to either side and to the back. You will do 3 rounds on each leg 5 times.
These simple exercises help to strengthen the muscles in the sole of the foot that have become weakened throughout the degeneration process secondary to plantar fasciitis.